Tuberculosis is a serious infectious disease that affects the lungs. A type of bacteria called Mycobacterium tuberculosis is the cause of this disease. This bacteria can also attack other organs, such as the kidney, spine, and brain. It's commonly spread when an infected person coughs or sneezes, leaving some germs in the air, and another person inhales them. A report by the World Health Organization reveals that about 10 million people usually fall victim to this infectious disease every year, out of which 1.5 million die annually. People who have HIV or AIDS has a greater chance of being affected by Mycobacterium tuberculosis. How does a person become aware that they have tuberculosis? An affected person may have symptoms such as cough, loss of appetite, weight loss, and tiredness. At an early stage, this disease is curable by vaccine or antibiotics, but its worsening phase can harm other organs and even glands of the body, such as lymph nodes. If it cannot be treated on time, this may lead to some chronic diseases. Let's start our video to explore the causes, symptoms, diagnosis, and treatment of this disease. What is tuberculosis? Tuberculosis is a bacterium disease affected by Mycobacterium tuberculosis. This bacteria affects the lungs, a condition known as pulmonary tuberculosis. Sometimes Mycobacterium tuberculosis spreads to other parts of the body through the bloodstream and affect organs like kidneys and the brain. The spreading of this bacterial disease is similar to viral infection, which means that when an affected person spits or coughs in the air, some germ droplets remain there. Another person, when inhaling these germs or droplets, moves them into his body and ultimately causes tuberculosis. Tuberculosis does not spread by shaking hands, sharing food, clothes, bedding, or touching anything. You have a greater chance of exhibiting this disease in crowded places or sitting with any TB-affected person. Good ventilation is the most effective method to prevent tuberculosis. Remember, not every person infected with this bacteria has tuberculosis. There are two main conditions to be infected. One is latent tuberculosis infection, and the other is tuberculosis disease. Tuberculosis disease can be fatal if left untreated. Latent tuberculosis infection is a condition in which an infected person with tuberculosis is not sick. It's not contagious. It means that when a person breathes and gets Mycobacterium tuberculosis, his body's immune system automatically responds to stop it. So, the person would not have any signs or symptoms of this infectious disease, but would have had a positive TB blood test and normal chest X-ray. A report from 2022 by the World Health Organization indicates that 10.6 million people were affected by tuberculosis, of which 5.8 million were males, 3.5 million were females, and 1.3 million were children. An effort to save people from tuberculosis globally has reached almost 75 million lives since 2000. The United Nations Sustainable Development Goals aim to completely end this disease by 2030. History of tuberculosis. If we trace the origins of tuberculosis, it dates back to 9,000 years ago. In 1834, the term tuberculosis was estimated by Johann Skolin, and it was called consumption in the 1800s. Dr. Robert Koch discovered Mycobacterium tuberculosis on March 24, 1882. At that time, TB was killing everyone out of 7 individuals in the United States. Later, after 1 century, World TB Day was declared on March 24, which is now worldwide familiar to educate people about the impact of tuberculosis on lives. CDC and many other organizations are working for the future of TB, where we can make it a part of history. Causes of tuberculosis. We know that Mycobacterium tuberculosis bacteria causes tuberculosis. Many people remain in a latent stage, even after being affected by this disease. At this stage, TB cannot spread to others. However, those with weak immune systems and having any other disease like HIV enter into tuberculosis disease. It is reported that almost 5 to 10% of people with latent TB infection can develop TB disease at any stage of their life, if not treated. Risk factors of tuberculosis. People with a greater chance of being affected by this disease include homeless people, people with alcoholic habits, people of older age, people who use intravenous drugs, those who set up groups, and foreigners, especially those who live in TB-affected countries. People with medical conditions such as silicosis, diabetes, mellitus, kidney disease, organ transplants, or head or neck cancer have greater chances of being affected by this disease. A more significant number of TB cases have been seen in children under the age of 15. Symptoms of tuberculosis. People who have a latent tuberculosis infection usually do not feel sick or show any other symptoms. However, some of the common symptoms of TB include coughing, which is lasting for more than 3 weeks, cough with mucus, and sometimes blood, chest pain, extreme tiredness and fatigue, fever, and loss of appetite. Suppose this infectious disease spreads to other organs or glands of the body. In that case, it may show the following symptoms: gland swelling, joint or ankle swelling, constipation, stiff neck, rashes on different parts of the body, and tummy or pelvic pain. Children usually experience fever, night sweats, weight loss, sickness, and coughing. Complications associated with tuberculosis. If tuberculosis is not treated properly or not cured by vaccination, then it could lead to the following complications: permanent lung distortion, Onnes syndrome in which cervical sympathetic ganglia are damaged, respiratory disorders, TB meningitis, and pneumothorax. Diagnosis. If you are experiencing one of the above symptoms, then your doctor will diagnose tuberculosis by taking some tests, such as X-ray, ultrasound, CT scan of your chest or affected area, examining a sample of mucus by examining samples of tissue or cells of the affected area. The doctor may also ask you for a Mantoux test or blood test. In a Mantoux test, a particular type of liquid has been put under your arm. This causes a specific type of infection on your skin if you are experiencing tuberculosis. Treatment. Tuberculosis is a treatable disease, but it's said that it is still one of the significant mortality contributors. Researchers are still trying to combat it, and they have found some challenges, such as lack of awareness, delayed diagnosis, and poor sensitivity to vaccines and medications. We will elaborate on some treatments for children, pregnant women, and adults. Latent TB infection treatment. Children or infants with latent TB infection and those under consideration of TB infectious diseases need proper consultation. Children under the age of 2 years are treated with isoniazid rifapentine for 12 weeks and once a week. Alternative treatment includes 4 months of daily rifampin. TB disease treatment. In children, TB is treated by prescribing anti-tuberculosis medicines for 4, 6, or 9 months. The above-mentioned 4 months of treatment is not recommended for children after the age of 12. If a pregnant woman is affected by this disease, she has a latent TB infection, and until 2 to 3 months, she cannot be treated to avoid an unnecessary infection. If she exhibits this condition, she will be treated with daily rifampin for 4 months or a 3-month daily regimen of isoniazid and RIF. If she is experiencing TB disease, then she should be treated for 9 months. She should be administered ethambutol, rifampin, and INH daily for 2 months. Then for the next 7 months, INH and RIF twice weekly. Prevention. These precautions are for those whom others can infect. Getting diagnosed, then starting treatment early. Wear a mask whenever you go to a public place. Make your room ventilating. Vaccination for TB. Bacillus calmette-guerin is a vaccine for tuberculosis disease. Where TB is common, it is given to children and infants. The BCG vaccine is only recommended for specific patients in the United States. They set their criteria for vaccinating children or infants. If you enjoyed this video, don't forget to like, share, and subscribe to our channel for more captivating content. And as always, stay curious and keep exploring.